Orthodontics is the specialty of dentistry that is dedicated to the treatment of dentoskeletal malocclusions. Although orthodontists use a wide variety of devices to treat patients, the most used are the multi-brackets appliances. To place a multi-bracket device, we first need to separate the molars to fit the band. So we have to make space a week before to help the adjustment of the bands and also to prepare the teeth for etching and to bond the brackets. Orthodontic treatment begins with a complete diagnosis, a medical and dental history, a facial analysis, a study model analysis, and a radiographic analysis. As a result, we establish a treatment plan. To place the bands, we have banding pliers, which help us to place the elastic separator to separate the molars, and then to introduce the band. Once we have opened the space, a week later, we place the bands. And we use a manual pusher and a chew toy for the patient to bite it in order to place it in the right place, at the right height and right tilt. To proceed with the placement of the brackets, it is essential to have a bracket holder, a bracket placement gauge that marks the height for each tooth, with the table where we have already established the ideal height on the previous casts. Once the braces are placed, we need a mature plier to place the ligatures. In this case, metallic ligatures or elastic ligatures. The vine guard pliers help to place the arch wire in place. We cut the ligatures. We can use distal cutting pliers to cut the arch wire and set it to the appropriate length. We have here two pliers. One is a band-forming plier, which we can use if we need to contour the band, and a band remover. In this particular case, we are not using the band remover, because it is only a bonding appointment. The first thing we should do on the patient is to put the elastic separators. After a week with the elastic separators placed, we are able to cement the bands. Now we proceed to remove the elastic separators.
Que yo tengo bastante.
For a proper placement of the brackets, we use the guidance lines designed and described by Andrews, in which we have first the major axis of the tooth and then the center of the clinical crown. From this initial tooth point, we describe the proper height on the rest of the teeth. To avoid contamination with saliva during the bonding, we recommend to use a cheek retractor that helps us to have an isolated work field. To have the best adhesion, we should prepare the enamel surface by etching it with a 37% phosphoric acid for 30 seconds. After 30 seconds with the acid, we can proceed to remove it. After the acid etching, we put the light-cured adhesive for a proper adhesion. We have treated the minimum area occupied by the bracket, trying not to affect the rest of the tooth with the etching acid or the adhesive. We take the bracket that should be placed on the prepared tooth and we put composite for its adhesion. We should place it at the center of the clinical crown. And then we have to check both height and angulation. Once we have checked height and position, we should remove the excess of composite and press firmly to remove any excess that can produce an error during the bracket placement. And then we can light cure. Keep on placing the brackets in their corresponding heights. Those heights that we had determined on the working casts. We would cement the rest of the brackets to complete the arch. Finally, once the brackets are placed, we put a super elastic nitinol arch wire to align all teeth. We have previously cut the arch wire on the model casts in order to have the proper length at the placement on the patient. We place the arch wire with the Weingart pliers, in this case on aesthetic ceramic brackets. Once the arch wire is placed in the mouth, we can proceed to tie it with metallic ligatures with the help of mature pliers. We should assure that it is well adapted with the help of a guide as we are tying the arch wire. Once all is set with the metallic ligatures, we cut the excess of ligatures, and then again with the Weingart pliers, we should bend inward the remaining parts of the ligature.